Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is 16 June 2025. This video is on a Nature Reviews Cardiology article titled Roadmap for Elevating the Manifestations of Aging in the Cardiovascular System. Hearts don't grow old, they adapt. This video is on the science of cardiovascular aging. What are the major hallmarks of cardiovascular aging? There are 12 interconnected hallmarks divided into primary, antagonistic, and integrative. Primary are the cause of the damage, example telomere attrition or loss of proteostasis. Antagonistic are the response to the damage, examples cellular senescence, mitochondrial dysfunction. And integrative are the manifestations of the aging phenotype, example chronic inflammation, stem cell exhaustion, and the mechanisms collectively drive cardiovascular aging. How does endothelial dysfunction contribute to vascular aging? Endothelial cells lose function due to telomere erosion, reduced autophagy, protein aggregation, and DNA damage, promoting a pro-inflammatory, pro-coagulant vasoconstrictive state that fuels arterial stiffening and vascular disease. What are the effects of aging on vascular smooth muscle cells? They undergo phenotype switching into osteogenic or secretory states, increasing extracellular matrix deposition and arterial stiffness. Age-related changes in extracellular matrix stiffness and oxidative stress drive this maladaptation. Probably this is the reason we see a lot of calcification in the older individual. What role does cellular senescence play in cardiovascular aging? Senescent cells, that is endothelial cells, vascular smooth muscle cells, and pericytes release SASP factor. These are senescent factors like IL-6 that drive inflammation, tissue remodeling, and systemic dysfunction. Clearance of these cells have shown to elevate age-related disease in models. What is clonal hematopoiesis of indeterminate potential, or CHIP, and why does it matter? CHIP involves somatic mutations in blood cells without overt malignancy. It increases with age and is associated with higher risk of cardiovascular disease, heart failure, and mortality due to increased inflammation. How is inflammageing related to cardiovascular aging? This chronic low-grade systemic inflammation alters immune responses and damages tissues. It is closely linked with endothelial dysfunction, impaired repair mechanisms, and heightened cardiovascular risk. Which lifestyle interventions have proven benefit in mitigating cardiovascular aging? Regular physical activity, caloric restriction or eat less food, intermittent fasting, and adherence to the Mediterranean diet reduce arterial stiffness, improve endothelial function, lower inflammation, and support mitochondrial health. Are there any medications with geroprotective effects on the cardiovascular system? Yes. Statins, PCSK9 inhibitors, colchicine, metformin, and senolytics like dasatinib, quercetin have shown benefits via anti-inflammatory, autophagy enhancing, and plaque stabilizing mechanisms. All the evidence in older adults is still evolving. Also, the current newer medications like SGLT2 inhibitors and semaglutide probably also belong to this list. What is the role of mitochondria in cardiovascular aging? Mitochondrial dysfunction leads to oxidative stress, cellular senescence, and release of SASP factors like IL-6. Therapies like NAD plus precursors, MitoQ, and mitochondrial targeted antioxidants, example SS31, show promise in reversing some of these effects. What are the future directions in gerotherapeutics for cardiovascular aging? Targeting autophagy, example spermidine, ACBP inhibition, immune aging, that is trained immunity, and novel anti-senescent strategies are under investigation. Validating biomarkers and clinical endpoints remain a key challenge. Until then, exercise optimally, eat less food, eat good food like Mediterranean food and heritage diets. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.